prescription drugs, when we're talking about substances of abuse, fall into a few select categories, and those can be particularly dangerous, especially in younger people that are what we call drug naive. In other words, they have not developed tolerance to medication. They don't have any history of knowing what potential side effects they may have or what complications may result. So when you're talking about adolescents or young kids using a prescription drug, you're getting into a lot of unknowns. Probably the biggest problem that we're seeing right now, and I see as a rapidly emerging problem, is abuse of prescription pain medications. In particular, things like OxyContin, oxycodone, Percodan, Vicodin, Dilaudid, fentanyl patches, but especially the oxycodone, OxyContin kind of things. A lot of kids, there's this peer pressure thing, and there's a curiosity about how something's going to feel, how they're going to experience life in a mood-altered manner that has people experimenting with these things. Unfortunately, as I say, if you're experimenting with these things and you don't have a lot of tolerance, really bad things can happen. So I think, all prescription drugs ought to be pretty much locked up in a safe place. Over-the-counter medications, if they're cough and cold medications, really the same thing. And as I say, you should be able to trust your kid, but I think you're a lot safer not trusting your kid in this area. I've had patients that had fairly tremendous addiction problems that knew where the drugs were. In other words, the word on the street is, once you sort of get into this drug-using network, is people know what houses have drugs. They know what little old lady down the street has a bunch of oxycodone in her medicine cabinet. And I've had patients who've then stopped at this house and, for example, their car stopped running or they had a flat tire and they got to go to the bathroom. Can I use the bathroom? A lot of medications are stored in the bathroom, and all of a sudden Aunt Tilly doesn't have her oxycodones anymore. But I've had other patients that will go from one friend's house to another, and certain friends have drugs and have connections and certain friends don't. And there are many creative ways to get drugs. With Coricidin and dextromethorphan, all you have to do is walk into a pharmacy. You don't even have to have $5 in your pocket. They're usually contained in small packets that they get stolen. And I think many of the pharmacies now are watching their shelves closer, moving some of this to where you at least have to ask someone to get the medication, and protecting that a little bit. But it's just, these people tell me that it's easier to get than buying cigarettes.